I remember being in the locker room in high school and hearing my friends talk about how, oh, my period's going to be here on Friday.
Mm,
Oh, mine will be here on Saturday. And I
mm,
remember thinking to myself, how do you know that?
yeah,
Mine could just fly in out of nowhere after being gone for 4 months and then hang around for
wow.
several months and then maybe be gone again or come back intermittently. It was just always such a wild card. And
Yeah,
I was absolutely floored, listening to conversations about, and even, learning in school about how your cycle should come every 28 days and you ovulate on day
yeah,
14. And that's that. And that is what is
yeah.
normal. So as I grew up, I started to realize, wow, I'm not normal. I'm not a normal
Mhm,
woman. And that feeling sat with me for so long. And
mhm.
one of my main missions in doing the work that I do is helping to really know your body is just fine and you have something called
Yeah,
PCOS. So here's what that means. And here's how you can actually manage it better outside some of the most common sort of pharmaceutical interventions, which certainly have their time and place for sure. But I always want
yeah,
women to know that there are alternative means, to get you where you want to go. So as I got older and I decided to become a registered dietitian, I learned a little bit more about PCOS and I started to understand, ooh, that's me, that you're
yeah,
describing me to a T: irregular periods, hair loss, mood changes, all kinds of things. So once I opened up my private practice, I thought, I don't want to work in PCOS, number one. That is just too complicated. There's too much going on. And the farther along I got, I started to understand, I am the perfect person to work in this space. Here I am,
yeah,
with a full understanding, a full knowledge base around blood sugar regulation as an
yeah.
RD. That's a huge bulk of our, what we learn in school. And when I got my master's, I felt very, very in tune with all of that. And here I am with PCOS. So I
Yeah.
did decide to step into that space and I have never looked back. It's just been an incredible journey. And I'm so glad that I did that. And now I work with women all over the world to help them better understand their condition and how they can manage it through diet and lifestyle modifications, along with supplements. And yes, digestion plays a role as well, which we can kind of chat more about later. But yeah, that's kind of
And
what my
so
story was. Yeah.
that's awesome. And I mean, we're going to talk about all the symptoms, but
Yeah.
what a good, I have a daughter. I'm pregnant with a second daughter, so now it's hitting home
Oh,
of
yes.
of young women and how you
Yes.
feel like, okay, something's not right, but you really have no idea what it
Yep.
is. And I know, at least for me, I didn't even learn about hormone health really until I was
Mm.
getting ready to start having children. And it's like,
Yes.
that's really late in life, right? When
Really,
that
truly.
should be taught during the teenage years at least.
Yes.
And so, what is PCOS? What we're talking about? Let's start there, and then maybe some
Yeah.
of the common symptoms, which there's a lot of them.
So PCOS stands for polycystic ovary syndrome. And it's kind of a big misnomer that, a lot of us are advocating for a change in the name because it makes it
Mhm.
sound like we are the same as someone who has these big, large ovarian cysts that can rupture and
Right,
cause pain. We can
right.
certainly have those, but those are different types of cysts. The cysts that
Mhm,
are present for many of us, but not all, and I'll get to that in a second, are really
mhm,
just immature, underdeveloped follicles. And how I
mhm,
like to describe it is they're all competing to ovulate and nobody's winning. So they
mm,
build up in the ovaries. That's why if we get an ultrasound and we see our ovaries, it looks like a little string of pearls. And I'm sure
mm,
you might have heard it described as such. They
mhm,
just build up there. And so we just collect a ton of them. And what can happen is when we're not releasing that egg on a regular basis and ovulating regularly, which then can look like a regular period, we see higher rates of infertility because we
mhm,
have to be ovulating in order to get pregnant. So we see that but you have to basically meet 2 out of 3 diagnostic criteria in order to be diagnosed with PCOS. And this is where it can get complicated because
mhm.
if somebody has a regular period, they might think to themselves or hear, oh, well, I must not have PCOS. That's the one that with irregular periods. But that's only
Right.
one of the diagnostic criteria. The other one is having polycystic ovaries, and the other is having elevated androgen levels, which are basically
Mm,
like one of the main ones is testosterone,
Mm.
or having symptoms of that. And elevated testosterone can cause facial hair and body hair growth in
Mm.
women. It can cause acne. It can cause us
Mm.
to lose hair. So we get hair where we don't want it and we lose hair where we do. It
Yeah.
can cause irregular periods. That can be a root cause. And it can also contribute to weight gain and an inability
Mm.
to lose weight as quickly as somebody without something like high testosterone. So you really only have to have 2 out of 3 of those in order
Yeah.
to get a diagnosis. But there are so many symptoms that are directly caused by PCOS, and there are so many symptoms that are related and connected. And I love to highlight that for women to show them, hey, this
Mhm.
could be potentially connected to your PCOS. So here's why just by working on your PCOS, you can make really great strides in other areas like eczema,
Right.
keratosis pilaris. There's all kinds of connections when it comes to skin and digestion and mood,
Yeah.
fatigue, cravings. So those are some of the issues that are associated with PCOS. But I will say too that because of this metabolic component, we see a lot of insulin resistance.
Yeah.
We are at a much higher risk for type 2 diabetes.
Right.
So, one of the statistics that I found to be just super alarming is that over half of us, so over 50% of us, will get type 2 diabetes by the age of 40. So,
Wow.
that's a staggering statistic. And again,
Wow.
like one of the reasons why I'm doing what I'm doing to try and
Yeah.
cut that rate down. We're at a higher risk for heart disease, stroke. When we're
Yep.
pregnant, we're at a higher risk for miscarriage, gestational
Mm.
diabetes, preeclampsia. The list goes on
Mhm.
and on. So it is serious and it is important. But again, not to fear monger. There's so
Right.
much that we can do to take back control.